What if leaking, urgency, painful sex, or heaviness you've started feeling in your 40s or 50s isn't just aging, but a sign that your pelvic floor needs support? Today's guest is here to explain exactly what's happening and how you can truly heal. Come join us. Women's Wellness Authority is your go-to podcast for discovering the hidden gems of holistic health and well-being. In each episode, we dive deep into the many layers of wellness, from mental and physical health to spiritual growth. Through insightful interviews with experts, healers, and thought leaders, we uncover alternative approaches, healing practices, and fresh perspectives that empower you to transform your life. Whether you're seeking innovative ways to heal your body, your mind, or nourish your soul, this podcast offers practical tools and wisdom to help you thrive in all areas of your life. Let's rewrite the rules of wellness together. Step into your power, reclaim your health, and discover what it means to truly thrive from the inside out. Welcome back to Women's Wellness Authority. I'm your host, Diana Raskowski, and today we're talking about something that affects nearly every woman, but is rarely explained well. And that's how perimenopause and menopause impact our pelvic floor health. Maybe you've noticed new symptoms: urgency, leaking, dryness, pain, core weakness, or changes in posture, and you're just not sure why. My guest, pelvic floor specialist Kathy Merchant, works with women every day who feel confused, dismissed, or like their body's changing faster than they can keep up with. In this episode, we're breaking down hormonal shifts, pelvic floor changes, emotional connection, strength coordination, posture, and what women can actually do to support their body in this next chapter of life. So let's dig in. Kathy, thank you so much for joining us today.
Thank you so much, Shaina, for having me. It's my honor. I appreciate it. Thank you.
So before we get into the science, can you share your story? What inspired you to become a pelvic floor specialist?
There were a couple of reasons for sure. I love treating my patients one-on-one. When I'm treating them one-on-one, I would love to kind of educate them, tell them which body muscles you're using, what is the priority, which I can do that when I am doing pelvic health physical therapy. That is my first thing. And the second thing was my own experience. When I was pregnant, at that time, I was not at all aware about my pelvic health, and I was very conservative. So never talked about it to anyone. Long story short, after my delivery, recovery could have been very different if I knew my pelvic muscles better. And not just that, my core muscles of the abdominal area would have been better as well. So I felt a huge understanding about pelvic health after my pregnancy. I wanted to treat my patients one-on-one. And me being a learner, I decided to start with pelvic health in 2019 and never looked back. I enjoy treating my patients one-on-one, educate them about all the wonderful things that our body has to offer. Our body is so very well connected that I realized after this course, and it gave me kind of an eye-opener in terms of connecting the past. When we think about past is like old is gold, the reason I feel like is kind of applied to this was because I learned about yoga in 2007 with the teacher's training course, some of the breathing exercises they would offer, and how it implemented so well in the pelvic health world. And kind of with our connections of different parts of the body, it just kind of gave me goosebumps when I think about it, how it is so interconnected, related.
Yeah, and that's a sign that it was like meant to be, right? That you're going to help other women with this. I think it's so common that women don't talk about this and suffer in silence, like with pain specifically within your pelvic floor region, because I felt very much the same. And I also remember after giving birth the first time, why didn't anybody tell me what was going to be going on? And also, like, I kind of was just told by my doctors, you had a baby. So yeah, these symptoms that you're having and the pain that you're having and these things you're experiencing are just like a result of all of that, instead of really fully understanding it. I never got pelvic floor therapy. I actually ended up seeing somebody once but never went repeatedly. To your point, how different my recovery could have been had I felt like safe enough to share those things. But why do you think that is? Why do you think women don't talk about that?
You're so right, Anna, on that because our emotions are very connected, right? And when we think about our pelvic health or pelvic area itself, a lot of our thoughts comes from the past. We don't talk about our body very easily with everybody. And as the pelvic area is very much connected to our intimacy, that also plays a major role. We kind of body shame a lot. Before my pregnancy, I always used to think like my pelvic area is mine. And during the delivery, I realized it is absolutely not mine. Absolutely no. That is the main reason when I was open to learn about pelvic health. When we have to undergo the training for this particular courses, we have to be model ourselves. And I was not ready to be a model for my own learning. I'm like, nope, I'm not ready for that. And I given up the opportunity to learn and do things in one of the university in Texas where I was before, Texas Women's University, and I did not go for that. And just after 5 years after my delivery and when I was ready to, give so much time for it, the same university I went again for the entire 1 year certification.
Oh, how
That
funny.
Yes. So I think first of all, the experience matters. Along with that, we didn't have the wide social media at that time. That is another area that is kind of limited. The third thing I do think is that a lot of people try to be in their own bubble. Long back, when women were not working, they would have their own group, they would talk amongst each other, and they would laugh. And that was common, which has changed a lot in the recent years with women doing working, managing house, kids and everything. They put themselves in the back burner, absolutely. And that plays a major role as well in our thought process. And as you mentioned, that nobody told you to be at, go to a PT at that time. Truly speaking, Diana, I had gone to a PT, but it's very under researched area. And because of that, the things which were 5, 10 years ago evaluated, looked up, is changing a lot at this time. The wellness is coming more into the picture rather than just looking the pelvic health in relation to any kind of disease or any issue. As we will talk, there will be a lot of reasons that you will understand that our pelvic muscles, pelvic area does not tell you immediately that, oh, I'm not well. It's something like if you are tight in your cervical area, upper traps, or if your calf muscles are tight, you're going to feel those when you're walking, when you are moving your neck or shoulder, and respectively. Our pelvic muscles, if they are off, they don't tell us that, oh, I am not well, unless we start having the symptoms for that. So the communication with our body is a little bit different in that area. And that also pushes our treatment, our need for pelvic health on the back burner.
Yeah. You were saying it's so common, right, for women to, and it makes sense. You're taking care of maybe a new baby, you have multiple children.
Yes.
Then they get a little bit older and you're like, you don't maybe even have a sense of the pain that you're experiencing and that it's related to that, and you don't have time now because all the other activities. And so you definitely take a back seat to that. Can we take a step back and just define what pelvic floor therapy is? So just start real simple. Yeah.
Yeah. So pelvic floor physical therapy, or I would say pelvic health physical therapy. And the reason I would like to kind of include pelvic health and not just pelvic floor is because pelvic health is more of a therapy, physical therapy itself, focusing on the pelvic area. Along with that, its connection with the different body parts that we have. So our lower back, our hip, feet, TMJ joint, neck area, they are all interconnected. And when we think about pelvic floor muscles, the pelvic floor muscles are the muscles. If you're sitting right now, the muscles of the pelvic area is going to go from the sides of our two sit bones that we are sitting on the sides, and on the front part from our pubic area back towards your rectal area. So I have my model with me to show you. This is the pelvis that we are talking about. And if you think about this is the coccyx area, the backside. So it goes from here to here, and it goes from the sides, the two sit bones that we sit on. So if you look at from the top down, see how open it is. And if you look at the model with all the organs being taken out, like bladder, uterus in female, prostate in male with rectum, then we end up seeing something like this. So this is our bottom part. I'm going to hold this. This is our bottom part. And if you look at it from the top down, this is what we see. And as you can see, it is the pink are all the muscles.
Oh, wow.
So these are the areas that we kind of
That's a lot of area, by the way.
And you feel
To
like it is a
ignore,
lot of
especially to ignore if there's problem.
And think about it, like I'm going to put all the organs in and imagine how nicely they are situated. So this is that uterus with the vaginal area. This is your bladder that goes in the front. And on the back, we have the rectum. So this is all that is situated in this area. This is how our body pelvis is. And when we take that out, the floor part, that is what it remains. Now, they are so, if you have seen this, the muscles are going all over from your coccyx to ischial tuberosity to your pubic area and to the sides. Not just that, these are the parts where the hip muscles are coming. And when the hip muscles are coming from the spine on the top, attaching into the front, into the back, they are talking to each other so much. So the pelvic floor PT is physical therapy related to pelvic floor, connecting your lower back, your hip, your neck, your TMJ, feet, all of that, addressing your musculoskeletal issues. So when we are thinking about any dysfunctions of those muscles related to bowel, bladder issues, or our intimacy, that is what we work on.
And I mean, a silly question, but what is it if I came into you? Am I doing exercises with you? I mean, obviously you examine the women and try to identify, but is it like when I think of like physical therapy, I'm thinking of when I've injured myself, I'm doing small bits of exercise, but are you doing those things, but for all of the muscles you just showed us?
When a patient is coming, first of all, we do detailed assessment, right? So we try to go to your past as much as you can think of, to the point where when you started with your periods, detailed about your bladder, your bowels, if you were having any constipation when you were in the childhood era or when you are right now, how is your digestion? How much is your water intake? So all the details that can go with your bowels and bladder, your period routine, your hormone levels, that is what we kind of look into. Major part of our initial assessment goes into knowing about your reasons and the history. So sign and symptoms of the current issues and the past history. Our pelvic floor assessment comes maybe about 10 minutes for during the assessment. But before that, we look, how is your posture? How do you hold yourself? What is your muscle tone in your abdominal area, hip area? How is your neck that you're holding? How is your spine? What is your muscle strength in them? That is what we look for. And following that, we do our pelvic floor assessment where the patient is completely covered nicely with one glove lubricated finger that we use to assess tone of the muscles, strength of the muscles. We look for if the muscles are kind of functioning the way they are supposed to be when we are putting the demands on them. So that is what we do. And once that is done, we connect dots. We make sure that we have taken into the consideration all the other pieces, and we try to give our assessment to the patient at that time, that this is what is going on, this is how we can work, and the treatment plan is curated absolutely for each individual according to their, presentation. It may not be possible to come up with reasons on the first session itself, because as you can understand, it is a lot to kind of consider. And the priority, I definitely go as a priority depending upon your signs and symptoms. So if the issue needs, I feel like, okay, the pelvic needs to be addressed first, that is what I go for immediately. But, that shift happens
Yeah, it's going to
accordingly.
depend. It's going to depend on the
Yes.
assessment. Now, something that I find really interesting, and one of my best friends I grew up with has the very same theory as you do, and I think it makes total sense, is the emotional connection, especially in this area, and the nervous system connection. So emotions and nervous system is fully connected with how those muscles act as well, right? So can you talk about that connection a little bit and why it's so important? It's not just the physical symptoms, but also potentially the emotions behind that is manifesting itself in those symptoms.
So, as I said earlier, it is not just merely an absence of disease that when we are thinking about the pelvic health, it is about how coordinately it is working physically. It is very much attached mentally and emotionally. And the reason is that our nerves in the pelvic area is quite a bit, exponentially much more. The second thing is that our pelvic muscles does go very much hand in hand with our intimacy. And when we are talking about that, it is very much related to emotions. So that area do have connection with our emotions. The third thing is that when we are talking about core muscles, the pelvic muscles are part of the core. In fact, it is right now primary muscles for our body. We always talked about core as an abdominal muscles, but in our body, the pelvic muscles are first muscles to support you, even when you are thinking about lifting your arm up. That lifting your arm up, just simply, if you do that, you will notice that there is some muscle activation in the around your lower back area. Now, if I'm doing right side, yeah, do that right side, and you will feel some movements on the left
Yeah.
side of your lower back.
Yeah.
Now, think about it if you are trying to lift a 5-pound weight, or if
Yeah,
you
you're right.
are,
You do feel it.
yes,
Yes. Okay.
right.
Okay.
So even a momentary microsecond previous of your movement, you need that stability. And that stability is given to you on the floor. If nothing is around here, everything is muscles and ligaments. Think about it. They need to work first in order for you to be
To
able to
create
be
that
supported
stability.
for
Yeah.
all the
Okay.
organs. Bringing it back, they are the primary muscles for our support. And if we are in fight, flight mode, or if we are very relaxed, it is going to give you some kind of effect through our body. Our body keeps the score in terms of some part of the, how we have trained it, how our brain has made connections. So it goes into certain area that stress or the thought or emotion. And that is the reason that it has made such a great connection unknowingly that we don't even realize it on a day-to-day life.
So
And
interesting. Yeah.
yes, it is working constantly for us. Sitting, standing, moving, it is working for us.
You know what? I never thought about it like that. I mean, I am a very visual person, so that the diagram of the spine that you showed and the muscles and then holding everything in, visually that just turns a light bulb on for me, right? Because it's the whole muscle is the floor of your pelvic region. And if all of those organs are in there, yeah, that needs. And if it's not, if it's weak, then yeah, obviously things are going to be off kilter, and then add emotions on top of that. I know there's a ton of emotional things that can happen, be trapped in within your body, and trauma or mini traumas or like anything, birth is a trauma, even though it's a
Birth itself,
beautiful
yes.
blessing because it is an experience, and every experience, no matter how many children you have, is different.
Yes. And when we are talking about like pregnancy and postpartum, we cannot forget about puberty. That itself is like a change for a girl. And during that change, a lot of emotions are going on for that particular individual. And depending upon how that individual is holding that emotion, that stress, we have a lot of other things going on during that time. The schools and friends, and obviously the demands are endless. So even puberty itself is a huge stage of difference. And truly, I mean, I won't say I don't like too much to talk about trauma because that word can be taken in a very different perspective. But I would say that our emotions and thoughts during that time does affect our pelvic health and how we are thinking about it, how we are accepting, appreciating the other's perception to ourselves.
So interesting. So, Kathy, as we're talking about emotions and nervous system connection, I'd love to talk specifically about how the emotional side of perimenopause and menopause really shows up in the pelvic floor.
When I'm talking about emotional sides during the perimenopause and menopause, I definitely would like to say that during those time, we are going through a lot of hormonal changes. And our estrogen is kind of dipping down quite a bit. Our estrogen receptors are there throughout our vaginal muscles, throughout our pelvic area. They are on our bladders. So when we are talking about functioning of those vaginal tissues, the muscles, the bladder area, the external orifices of that urethra, the bladder from where urine comes out or where the bowel's coming out, those tissues, elasticity, plumpiness, the moisture in that area is very much dependent on the estrogen hormones. And when that has been taken out, the muscles of that area loses its elasticity. When that elasticity is kind of reduced, that affects the functions when we are talking about leakage of urine, bowel, or difficulty of controlling, supporting our organs in the pelvic area. And the efficiency of support reduces at that time. However, we continue to function the way we are doing it. That doesn't change. Being in our late 30s or early 40s does not change with our demands that we have. We continue to take care of our kids, house, work, and everything. Those changes are kind of visible in many different ways at that area. And on the top of that, when these hormonal changes, the shift is happening, it is not only affecting our pelvic area, but it is also affecting our digestion, our sleep cycle, our stress level, the certain things that was very normal for us to do in our 20s and 30s are not going to be same in our 40s and 50s. Those shift that happens creates stress to us. It is not expected from our outside world that what we are going through, and we have to understand it on our own, kind of, that what is our body is talking about. Well, that ends up into a stress. That stress further impacts our pelvic muscles during that time and creates further irritation, weakness, because they are not efficient anymore, and creates pain or irritation, lack of support, and many different things. So, when we are talking about connections with our neurological connections with our pelvic muscles, we have to consider the hormones. We have to consider our stress level during that time, how our body is adjusting to these changes at that time.
Our body is naturally supposed to adjust to estrogen levels going down, but you just indicated that that's going to cause our muscles to be sort of less elastic and therefore causing those issues. So my question is how can I, or what can I use? How can I solve so that I don't have such painful symptoms?
So, our body is going to undergo changes, and that is unavoidable. And if we are blessed, we will go through that, right? But what happens is that somebody has mentioned to me, and I really loved it, that in order for us to enjoy our life later on, we save money. And the saved money that we have is going to be good for us when we are not earning. Something similar that kind of I keep here, and I strongly believe in that, that taking care of your health beforehand is going to get you much more later in the life. Now, in terms of pelvic health, something similar. You can moisturize your vaginal area. What does that mean is that putting any kind of moisturizer which is specifically meant for vaginal area. Just like if you're putting a lip balm on our lips during the winter season to avoid cracking, something similar that you're doing it for the vaginal region and vaginal area. Take a kind of a pea size moisturizer, which is like a good clean love. There is Kendra. There is other, like a lot of V Magic on Amazon. A lot of different options are available in the market. Just take a little bit pea size, put it around the vaginal and the pelvic area, a little bit around the internal air region as well. That helps your vaginal area, and do it pretty much every day. Maybe have a nighttime routine, and you can use coconut oil. If you're feeling like, okay, you don't want to use any external products, you can use coconut oil. Obviously, our vaginal area does have natural pH level that helps the microbiomes in that vaginal area to be at the best to avoid any kind of UTIs and infection or something like disease point of view. There is no research, but these moisturizers help to maintain that pH. If you
Okay.
want to use coconut oil or olive oil or castor oil, you can absolutely use that. In fact, for the hemorrhoids, I generally recommend my clients to use castor oil in that area. If you're using oil, just put a liner at the night because it's obviously going to kind of create a little staining in the underpants. So you can use that. But that is one thing that can be used. Another thing that is number one now recommended treatment is estrogen cream around the vaginal area. If you are open to it, 100% try that. That does make wonders and works throughout the vaginal area.
Is the moisturizer like a prescription, and is the estrogen cream a prescription?
So, no, the moisturizers are not a prescription. It is, you can definitely take it from the counter or from different stores or online. Hyaluronic infiltrated, those moisturizers work pretty much better. But estrogen is definitely prescription drug. It can be in the form of cream that you use and use it vaginally. But the reason I mention that is because when we are talking about vaginal dryness, pain with intimacy, or insertion, this definitely helps immensely. Repetitive UTI, which is very common during this time.
Oh,
And
interesting.
yes, this can help. With that being said, with the pelvic floor PT point of view, if the UTI once coming out to be a positive with the infection, it is not necessary if the second and third time it will come out positive with the infection. And many a times, the physicians may prescribe antibiotics for that, and it doesn't help individual. If that is the case, it is mainly related to your pelvic floor issues that has kind of stayed. The recovery did not happen efficiently following the first bout of infection, and your muscles, your nerves in that area did not come back to the base level that they were supposed to come, and it ends up into creating further dysfunction and mimic the symptoms like UTI again and again for you. So it is
Hmm.
important to kind of assess whether you have UTI or not after that.
Yeah, interesting. So you're saying the symptoms can be very similar to a UTI. If taken a medication for a UTI and it does not go away, that's an indication to you that there's something other pelvic health floor wise going on that needs to be addressed.
Absolutely, yes. Because of those changes that is going on in the body, our nervous system also gets into the effect. The blood circulation in that area is also affected. So now
Yeah.
when we are talking about the nervous system is affected, our blood circulation is affected, the recovery in that area gets also affected. The body will continue to function the way it wants to get the work done, but will end up with certain other symptoms, and that
Yeah.
can be the symptoms of we discussed about earlier.
Yeah. What's the difference between estrogen and progesterone cream? Because I've been told to put progesterone cream in that area, that can help too. So is it serving a similar purpose, or is it just to help levelize progesterone levels, and the estrogen or the moisturizer can sort of help with the estrogen levels?
So it is kind of helping the progesterone level to balance it out as well. Because think about it, like if you're not having progesterone, like how they are prescribing estrogen is very important. Because if they are just giving you as a vaginally, the intention and the amount is important. If the progesterone is not given, depend as I said, like I am not the right person to say whether you need it or not. But if the progesterone is not given, then that is going to continue to create the uterine lining, and it will continue to create like a kind of a cycle for you. So when we are talking
Because
about
progesterone,
postmenopause,
yeah.
yes. So when we are talking about the postmenopause, once you have menopause, you're not going to get your cycle. But if they don't give you appropriate amount of progesterone, then it is going to create the lining in the uterus if you have the uterus, and that can create the bleeding for you. So that is the main reason that they have to balance it. That's all I can
Yeah.
say.
Okay. So they are different. They do serve different purposes, but if you're in this
Mm. Yes.
period, you probably don't want to be doing progesterone cream because that's going to further encourage your body to have a cycle, which your body's naturally trying to not do. So I feel like my body would be real confused.
I think we that part needs to be kind of good to kind of ask
Yeah,
a
professional.
hormone. Yes,
Yes.
absolutely.
Anything that we talk about on this, like this is just a conversation to help open people's eyes. We are not diagnosing. It is for the individual listeners to go to a doctor and look into these things. I just think these are common questions. These are things I share that I've had conversations with women in my life about. And if we're having it, like we said earlier, if we're having it privately, why not, my door's open. Come on in so we can talk about it and normalize some of these things that are happening with us so that everybody doesn't have to feel alone. So, how and why do strength, coordination, and posture shifts during this phase of life happen?
As we mentioned, that those changes that are happening in our system, it is not just affecting our vaginal area, but it is also affecting the other parts of the body. And then when we were talking about how to manage that area, that is one thing that we talked about, moisturizing. The second thing that can be done is kind of taking a lubrication. The lubrication is not same as moisturizer. Lubrication is mainly used during the intimacy or anything that when we are inserting into the vaginal area. And that is when we use the lubrication for. There is a slippery stuff, good clean love, Uber lube. Those are pretty good that they can be used with. I'm not having any recommendations for the CBD type lube, but I think Uber Lube does have lubrication with the CBD that helps individual. Other than that, I would strongly recommend to continue with any kind of weight bearing exercises or simple stretching movements that helps your muscles and that helps your bone to recover much better during this phase of life. It is possible that maybe in your 20s and 30s that you really felt good with certain type of exercise. You may not able to feel the same way during your 40s and 50s or 60s. So you may have to change your routine, but doing some rotational exercises, giving the hips and the spine some kind of jerk on a daily basis helps with creating more stimulation for your bones to grow and kind of avoid osteoporosis in that area. Maintaining your muscle strength, not in your pelvic area, but as we talked about it, like how our body is so very well connected, those simple stretches and exercises does impact greatly for your pelvic health as well. So doing that supports our mood, supports our digestive system, supports our overall musculoskeletal system as well. So if you are able to spare even 10 minutes a day, every day, keep some kind of routine for yourself. Include some kind of weight bearing, jerks, like jumping, simply jumping from one step to another step. Rotational movement also helps with digestion. It kind of keeps our fascia more flexible and mobile. So it is kind of like a 10-minute of a session that you can do one day certain exercise, one day maybe breathing exercise to relax yourself, one day meditation, whatever works best for you. 10 minutes, that could be a game changer for sure.
And really, what you're suggesting is to move. right?
Yes.
And I think it is challenging for those who are working, especially working from home and you're sitting all day. If you're in an office and you're sitting in your office or your cubicle, you just get up and move around because that in movement will probably have a greater effect on you as you get older. And that's probably why when you sit too long and you get up and you're stiff, it's your body's way of telling you you need to, you need to move a lot more.
And as I said, like earlier, you don't have to worry about you being stiff or being in one position because your body was resilient. Your body was able to recover very well. Now it is going to tell you a lot many things more than what you want to know or what you want to experience. So a simple sitting job that was pretty good for you 10 years ago is not going to be the same. So keeping a bottle with you, going to get up and talking while you're in the meeting, stretching simply in the different position. I know a lot of people started having standing desk and you can do that. But I would definitely recommend to kind of do both of that because even long time standing does not work for you. So
I
change
learned
in
that.
your position. So change in your position is more important than being steady.
Yeah. Yeah, I
Yeah.
did the standing desk, and I felt like if I stood for too long, I had certain aches that I then had also if I sat for too long, and I talked to my chiropractor, and he said, "It's not the standing or the sitting, it's you need to move and switch."
Move.
So that makes
Yes.
that makes total sense. We talked a little bit about whole body connection, and something you said to me kind of like set a light bulb off when we were prepping for this call. And that's that a lot of women don't realize how connected their pelvic floor is to the rest of their body. And one example you said was TMJ and how I guess an unhealthy pelvic floor can affect TMJ. Can you maybe talk about that a little bit, or there's other examples of things similar to
Yes.
that?
Think about it like if you were having any kind of pain in the body, your immediate reaction will be that you don't want to move that part. Your body is going to automatically say, okay, let's safely restrict your movement. And that is your safety. That is your healing part. So when we are talking about the TMJ, when these muscles are kind of irritated and tight, they do not let your joint to move open completely or close appropriately either. Any kind of chewing movement is going to be affected at that time. Now, these muscles are very much connected to our neck muscles. And all of those areas, if they are irritated, they are going to be tight. If you clench your teeth very tight, imagine, think about how your system in the body is working as well. And if you're clenching your teeth, automatically you'll see some tightness is happening in your belly area first, and then going down towards your pelvic area, and then going down towards your feet and maybe around your hands. That is kind of giving you like a entire body getting tight. Now, if that is staying at the constant level, it is going to create an issue for your pelvic muscles. The second reason is that our fascial connection. So, what they have figured out maybe about 15 years ago or so, but they saw that one of the fascia that goes starts from our toe and our feet, and it goes from the great toe to the inner part of our ankle to the knee, all the way from the inner side of our leg, basically, and passes through our diaphragm and kind of comes all the way into our passing through the neck. It inserts into our upper palate region. So the fascial connection in our palate has kind of a direct connection through our pelvic floor to the foot. And when we are talking about passing through these stages of the fascia, so the muscles are connected into this fascia directly or indirectly. And it is going to affect maybe your throat muscles and maybe your diaphragm, because when we are breathing, there are certain movements that is happening in our upper palate that is affected. And then our diaphragm is affected. And then our pelvic floor muscles are affected.
It just goes back to that whole body connection, right? So just because I have a pain here, there's always like a root cause of this, right? And so,
And you kind of came to a very right point when you were mentioning that looking for the root cause. And when I was mentioning, when we are doing the assessment and looking for the other things to look for reasons why you have certain symptoms, that is exactly what we are aiming for. And when doing the assessment, it's like peeling an onion. One time we are opening up one symptoms that has been, covered, and maybe sessions or 4 sessions down the road, patient says, "Oh, I had this issue before and it completely resolved." But it resolved there, that particular time. It compensated in the other part of your body that you continue to work with. And then it's kind of resurfacing in a different way for you. So finding a root cause is kind of our goal. And we may able to achieve it in one time, or it may take few sessions, if it is very old.
and we talked about this in the other episode, that there are certain times in a woman's life that they should, if they're experiencing these symptoms, see a pelvic floor specialist. And that's right. You said in your 20s, so pre having children, during children, after children, and during this stage in your life, right?
Yes.
Like
Yes.
perimenopause and menopause, because in every instance, your body is changing in a way that it's supposed to be naturally, but things can happen. And if you think about that whole body connection, if one thing is off, your body's going to compensate so that you kind of feel better. And then if it doesn't recompensate, you're going to have longer term effects. So I love that talking point, and just thinking about those are the times in my life where I can see somebody, and you can make those connections for someone who has no idea. I would think that a normal woman would have these issues and their first person they'd go to is probably their regular physician or their gynecologist, and not think that a pelvic floor specialist can help me in all the ways that you talked about today. So incredibly insightful.
Absolutely. Thank you so much. And I do think that if one is looking for the answers where one is standing, what is their body, and how the pelvic floor needs to work for that particular individual, I would 100% say definitely go once to understand your body and get the base idea. That is a first and foremost thing. And that itself is going to help much more when you are not in line. So, if, for example, you are able to do pretty good with the pregnancy and you're like, okay, I think I know what I'm feeling. How should I be doing? That's good. Perfect. You're in the postpartum phase after 6 weeks or so, or 8 weeks or so. You're feeling pretty good. You are connected. That is perfect. You are understanding your body much more if you have your baseline, and you can take yourself much better from the recovery path that you need to be on during these changes of life. And if you are not able to recover, you will know that much better if you have a baseline.
Yeah, that's so true. Any of parting advice for women in their 40s and 50s? And then for anyone that falls outside of that bracket. So say somebody's listening who's in their 30s, what advice would you give during this time?
Anytime when somebody's not feeling right, look for options outside. Do not kind of continue to think like, okay, it is going to be fine. Let me figure this out. There are a lot of options available in the market. And I know that our world is changing. The research is exploding. And we are still behind like anything. But I'm very thankful that I am part of this era where all these new things are coming up and I'm able to be part of it. But anything that does not feel right, look for options, look for answers. If the changes are, as I said, like it's unavoidable, but your body responds very beautifully and it is going to give you a healing advice. You deserve to be feeling strong, healed, and comfortable, confident with your body.
Yeah, you
And the
don't have to
options are available.
suffer. You don't have to suffer
Yes.
during this time in your life, which is, I feel like, the dialogue around this time now with all the crazy memes. And it's just like trying to normalize that we're unbalanced and these are things and it's just the way it is. And it drives me nuts because there's so many experts out there like you that can help all women out there. So, with that said, What is the best way that the listeners can access you?
I have my physical therapy clinic in Fort Mill, South Carolina, which is Lotus Physical Therapy and Pelvic Health. I am available on the website www.lotusptph.com. I am on Instagram with the handle LotusPTPH as well.
Awesome. So, listeners, if you've got questions, reach out to Kathy. And
Absolutely. You can reach out via email, which is a contact form is on the website. My number is 980-748-9160. You can call me at any time.
awesome. So, Kathy, thank you for bringing so much wisdom and reassurance to this conversation. I love how you help women understand that these changes are not something to fear. They are something that we can prepare for, work with, and heal through. Listeners, thank you for joining me on Women's Wellness Authority. If this conversation spoke to you, share it with a friend who might need this encouragement and help. And don't forget to subscribe on your favorite podcast platform or on YouTube so you never miss an episode. And if you're enjoying the show, a 5-star review means the world and helps more women find us. So until next time, stay curious, stay empowered, and most of all, stay well. Thanks, everyone. Thank you for tuning in to this episode of Women's Wellness Authority. If today's conversation inspired you, shifted your perspective, or sparked something within you, I'd be so grateful if you'd subscribe, leave a review, or share this episode with someone who might need it the most. Have a story of your own or something you'd like to share? I'd love to hear from you. You can connect with me on YouTube, Instagram, and Facebook at Women's Wellness Authority. Please note the content shared on this podcast is for informational purposes only and is not a substitute for medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider regarding your health and wellness decisions. Until next time, stay curious, stay empowered, and most of all, stay well. Thanks, everyone.